JoyNews' sources reveal that the victim from Nsawam is a Ghanaian citizen who returned to the country on March 20 this year before President Akufo-Addo announced the closure of the country's port. We'll get more details on that. Dr. Albert Antobrebuating is the Deputy Director of Health in charge of public health in the Eastern region. Doc, thank you so much for your time this afternoon. Hello, Doc.
And to your viewers.
Right. Thank you very much. Now, first of all, it looks as if the Eastern region is becoming, the cases in the Eastern region is escalating rather quickly. Do you have a reason to account for this?
Well, you realize that when it all started, it started with Greater Accra, Kumasi, and then we came on board. And our index case started with one person, a construction worker with the AFCON company. And he had as many as over 200 contacts. So it shouldn't be surprising. If you have one person gets 200 contacts and we test, then you can imagine. In fact, he has, from his contacts alone, more than 40 people are positive. So that is the situation.
Yesterday, because yesterday I was live in the Eastern region here on this show, getting clarification on some cases that have been recorded there. Today we're getting another case that we're having to talk about. So this is purely from the contact tracing that you're conducting, correct?
Majority of the cases which have turned positive are contact of the index case.
Okay.
Yes.
So give us more details about this new case, please.
Which new case?
These new cases that you've recorded, the two.
Well, the Nsawam case actually was, it's a case that the test was conducted in the Greater Accra region.
Okay.
He only happens to live in Eastern region. And so the data on him is actually belongs to Greater Accra. He lives in Eastern region and presented his report to us. And once he is positive, we are managing him. Yes.
And how is he responding? Is this person asymptomatic? Is this person showing symptoms?
He is doing well. He is doing well. You know, he's somebody.
So he's showing symptoms?
Yes. He is asymptomatic and obeying instructions to stay at home and all that. There is no issue about it.
And yesterday also, we got a lot of text messages here, and right now I'm holding my tablet. People do send us messages from the region about how they feel. One of the concerns they've raised is that the level of education in the region is not as much as expected, and so they believe a lot of people do not really understand the implications of their actions, even in these times of COVID-19.
Is it only in Eastern region?
Not only in Eastern region. I'm talking about Eastern region because we're talking to you, and because I ask people to directly, those who live in Eastern region, to send us messages.
Eastern region, it's a national problem.
So I'm asking because it's you, and we're focusing on Eastern region.
Public education is not the responsibility of Ghana Health Service in that case. This is a national issue, and there are organs who are mandated under the Constitution to do that. NCC and Information Services. They should take up that mandate.
Okay.
And then we, at the health sector, will also know what to do. So
the question I was going to ask is that it is a national crisis, but you are the experts, and you are in charge of this district. So what I was actually going to ask is, what you think?
No, the public education is going on, but we can do up to a certain limit under the circumstances. It is not as if it is not happening at all. It is, yes.
Is funding
would have been better if the other organs who are mandated are also doing their part.
Is funding a problem?
Funding, yes.
Funding is a problem. What else are the challenges you're facing as far as the public education is concerned?
Well, Those organs who are responsible to be helping us to be able to do that are not available, that I've said. Yes.
Okay.
And funding is a problem, because if you want to do this, you need to move to the communities and do it. Operational cost.
Thank you very much, Dr. Albert Antobor-Boateng, for joining us this afternoon. He's the Deputy Eastern Region Director for Health there, giving us some details on 2 new cases there. He says that even though the person lives in that district, the information taken belongs to the Greater Accra region, because I believe that that's where the person's details were taken. And again, the issue about public education, remains a big problem in the Eastern region. At least that's what's coming up. It is a national issue, of course, but this is what has been coming up since we started recording cases from there. Some of you have been sending me some messages. We'll try and read them out. Let's see. This one says, we need to seriously question government's claims that we have conducted about 80,000 tests. Now it's clear that the impression that 80,000 people have been tested so far isn't factual, but I want to believe that the president took the decision to lift the partial lockdown based on what government says it's aggressive testing. Well, if you heard the professor describe what they did, he explains the process. He explains that you could have like a sample of 1,000, and out of a sample of 1,000 you could have about 100 coming out. And so when you put all of those together, it's not surprising that they've been able to do that number of conduct that number of tests. So it says, good afternoon. My name is Dr. Ben, watching you live from Sishi, a Sam in the Western North. So it's so sad that we here need more donations, but we still, okay, so you hear about more donations, but we health workers, he says, within the district are still not getting PPEs to work with. And that's also a big issue that came up at the press conference. We'll try and bring you more of that press conference. There was a question about it. We're told that it will be investigated. This one is texting us from Oti region. Says, my question is simple. What is keeping the Ghana Health Service from giving us updates as in when the cases come in? Valid question there. Hopefully we'll get some answers as we go along. Well, let me remind you of our total number of cases so far. If you look on the screen, you have an idea what the number is, but I'll take you through it, don't worry. So our total confirmed cases as of now is 1,154. And we're also told that 120 people have recovered so far. Usually, sometimes when you look at the World Outlook, for example, you see a lot more people recover than those who have died. So obviously, it is the same. The case is the same here in Ghana. 120 people have recovered, but 9 people have died. And we're also given a breakdown of those who have recovered from which parts of the country they are. And that press conference also. I'm going to take a very quick break. When we return, we'll talk to NGOs in health. They have a letter, they're calling an open letter to President Akufo-Addo with some recommendations on what to do going forward.